Hi, I'm Kristi Frank, and welcome to America's Leading Doctors. This is the show that brings you the country's best and brightest doctors in the country, and today I have a very special guest, Dr. Dale Williams. Welcome to the show, Doctor.
Thank you, Kristi.
How are you?
I'm doing well, thanks.
So before we get started, let's talk a little about your background.
I've been in chiropractic for about 16 years. What drew me to chiropractic was the natural aspect of health. I found that most of my desires for health and wellness come from a natural form rather than from some outside source. So I think it's easier to stay well than to get well, so that's what drew me to the natural tenets of chiropractic.
I love that. So what would you say one of the biggest issues are that your clients face when they come to see you?
Well, most people, when they first come, are in pain. And that's what drives them through the door. But the biggest challenge that we have is helping them understand that that pain did not start the day they woke up with the sore neck or the lower back. It started with an accumulation of stress that they weren't able to manage appropriately for a period of maybe a month or a year or even decades.
Right. What would your practice do? Not only treat the pain and then...
In our practice, we try to focus more on the scientific side, or the neurology. The nervous system is the master control system, controls everything that happens. And one of the signs that the nervous system isn't functioning properly is pain. But it's a small side of it. So once we've dealt with the pain, which is important for us to do as soon as possible, then we want to see if we can get optimal neurological function, the nervous system to function as it should, so that the people can continue to get well and even increase their wellness once they've been introduced to our office.
How does your practice help them overcome that? Do you involve a lot of teaching?
We do. Education is a large part of it. Lifestyle, the way we're living today is made up by the lifestyle that we've had from the past. So our choices that we've made in the past lead to our current circumstances. So in the practice, for a practical side of it, we do neurological assessments. We have some advanced equipment which gives us a look inside the nervous system, inside how the nerve is functioning and controlling the tightness or the looseness of a muscle, or how the nervous system is controlling the organs and glands, if it's controlling it appropriately. And that gives us a better insight so that we can measure if we're making the accomplishments that we want, other than just reducing the amount of pain that somebody has or eliminating the pain.
Right, and there's certain things that sets your office apart from other chiropractors, and let's talk a little about that.
We have 4 different doctors in our office. Anybody who has been to to more than one chiropractor know that they're varying techniques, and they all work quite well. Some people prefer one technique over another. In our office, we have 4 different doctors, and we all apply the science or the art of chiropractic a little differently. So people can have more of a lighter adjustment or more of the heavy manual adjusting, depending on which doctor they come to in the office.
Which is a great offering. It's a wonderful service.
Yes. Let's
talk about someone, maybe one of your favorite patients that you've kind of kept with and overcome their pain and changed their lifestyle.
That's a hard question because there's so many.
Yeah.
But we do have, I have in my mind a patient that I started seeing for migraine headaches. She'd had migraine headaches for years, was a teacher in school, was used to taking medications for migraine headaches on multiple times in a week. And after starting chiropractic care, the intensity of the migraines decreased initially, and then the frequency decreased to where she was only getting a migraine maybe once every other month or so. And those are life-changing in that they feel better, but it also changes how they're able to function in their life.
Oh, we know this, that when you're in pain, when you're not feeling well, your entire life has changed.
Right.
Your entire life.
And it affects how she was able to perform in her work as well, because as a teacher, she's dealing with children and kids all the time, and she's able to perform better in her occupation.
What would be that special thing that your patients would say about you?
What we hear frequently from our patients when they come to the office is that we have a wellness atmosphere. When they come in, they feel very comfortable. We have a tremendous staff that help people to become involved in a wellness type of approach. They receive a wellness tip every time they're in, and so a lot of our patients say that they like the atmosphere of coming.
What are some of the services besides basic chiropractic care that you offer them as well?
We also have massage therapists. We have 2 massage therapists on staff. It works well in conjunction with the chiropractic. If you can get proper alignment of a joint, neurological function, and the muscle to relax simultaneously, you've got a hat trick as far as I'm concerned. And the massage therapist can help in that muscle department a lot, help get that muscle relaxed, so you can hold that adjustment for a longer period of time.
To that end, besides all the services and the wellness atmosphere, what do you think that one special thing is that separates you from the rest of the chiropractors in your area?
We really focus on education. We have wellness orientation workshops. We also have advanced workshops where we'll take a topic like how getting adjusted can help with your golf game. Or we might have one on how to eat to balance your hormones. So we try to focus on the 3 aspects of, or the 3 stresses that affect our lives. How we move, how we eat, and how we think. So those 3 aspects are the teaching basis of educating patients in how to develop a wellness lifestyle.
Well, now you have me wondering, what would be your one special tip that you can share with our viewers, maybe for ultimate wellness?
One special tip is a tough one because there's 3 important parts.
Okay.
But I think if everybody would see that they get some movement every day. Chiropractic is addressing the individual joints to make sure they move, which we do very, very well. But a lot of people, if they will keep moving, then they don't have to have the adjustments as regularly. Everybody says, do I have to get adjusted all the time? And the answer is no, you don't. The more you keep your lifestyle in conjunction with health and wellness, the less often you will need to get checked or adjusted.
That's a wonderful reminder. We all get so busy, and to keep moving and to keep healthy is, thank you for that extra piece that I actually needed to hear today, so thank you so much.
Thanks.
Well, is there a place we can go to find out more about your office and get more wellness tips?
You bet. We have a website called keepyourwellness.com, where you can get information on the doctors that are in the office as well as the services that we provide in our office.
Keepyourwellness.com.
Yes.
Great. Well, thank you so much for all your information and being here with us today.
Thanks, Kristi.
Thank you. And we'll see you again next time on America's Leading Doctors.